You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast. Okay, well, welcome everybody to another episode of the NeuroRESET podcast. We have a special guest today, Ryan here. Ryan, actually, he and I go way back. He's been a patient. He started as a patient and became a friend. And we've worked through a lot of different things together, tried some different businesses and things like that. But ultimately, you know, we came together because we understood the journey that needed to happen with everybody, with a lot of people who are dealing with chronic symptoms and things like that. So this is partially going to be a little maybe testimonial, but really just looking at the processes of what people go through from your standpoint, because you fix by nature, right? You fix things by nature, and so you've adopted that into your own journey, and you know, really empowered yourself. So everybody, welcome Ryan, and we're gonna have some fun here today. So
awesome, yeah, thank you.
Is this your first podcast?
My first podcast.
If you say Huberman, I swear.
Oh yeah, I've been there. No. I think this is. I think I've done some tech podcasts before.
Yeah.
But that was like when podcasts weren't called podcasts.
Okay.
So that was like 15 years ago.
Yeah.
I did some things in tech. Yeah, I tried to, get on at the bleeding edge, and it was what it was.
That's all right. Well, here we are, full circle.
All right.
So first, let's talk about. Tell everybody a little about your journey before we ever met.
Oh wow. Okay.
Yeah, that's going there.
That could be a long story.
A multi-part podcast.
Yeah, for sure. I mean,
so what we'll do is we'll keep it like super simple. Like if we can do cliff notes, but anything you can totally expand on whatever you want.
Yeah.
And if you feel it's important for anybody listening to hear it, go for it.
Yeah, I think there's definitely some very important key moments.
Yeah.
In life. Growing up, I'm not going to go into like.
Sure.
Don't worry. But growing up, when I was, I think I was around 12 years old, I started having some neurology issues. I started having seizures, and couldn't figure it out. I mean, there was so many. I've been to doctors. I'd go into the hospital. They try to, they'd hook me up to the EEG. And they would throw video games in front of me and flashing lights and strobe lights and everything. I would have like 2 a day at home. As soon as they put me in the hospital, nothing. I wouldn't have them. And then so later on in life, I met another chiropractor. I was in Ohio at the time. Met a chiropractor, and he's like, I want to kind of go about this a little bit differently, kind of get your body in alignment so that it can start healing itself, see what's going on. And he actually went down the route of saying, hey, I also want you to go see a therapist. I was like, a therapist? Like, what does that have to do? I think I was 16 at the time.
Yeah.
It's like, what the heck does that have to do with this? And went and saw a therapist, and we found out through maybe took 6 months or a year or something like that it was my body's way of kind of expressing this thing. It was
like
basically
relieving the stress internally.
Yeah, it was basically an anxiety attack. Didn't feel like anxiety, but I would have a seizure. I didn't have grand mal seizures where you shake everything,
But it would these things would very much look like a seizure
and feel terrible.
Yeah.
They honestly, they felt terrible.
Yeah.
It's created so much trauma, honestly, because I would know that they were coming. I would have this. They actually call it the aura effect.
Yeah.
So I would have an aura, which in my case was a deja vu. I could literally tell you exactly what was going to happen in the room for the next 10 seconds. And then I learned, and I would have to alert people around me, like, hey guys, I'm about to go out.
Yeah.
And then I'd be out for about 2 minutes, and by out I would just kind of
like blackout,
pass out type of a thing. I guess I would swallow a lot and kind of just not know what's going on. But then it would take me like 6 hours to come back and recover, to feel not like to be able to do so. So I think that was an important part when you asked me kind of where I came from. And then I also, kind of another important part of me is, since I was, I think about 8 years old, I started programming. Someone introduced me. They gave me this book this big about programming in C++ at the
Yeah.
time. So if any engineers don't know how.
Yeah, so my dad was a software engineer, and all the books from all like the DOS all the way through. I mean, for
books.
like for dummies, right? Like those were the best books. It's like C++
Yeah.
for dummies or whatever.
Oh,
they
yeah.
cover. I remember seeing that like when I was a kid. Yeah.
Yep. So I read through all those, and then I just seemed to align with the engineering mindset quite a bit. Like my brain just works really well from an engineering process, 1, 2, 3, 4 perspective.
Mhm.
And then so how we met, I had been seizure free for a long time, years, probably. I'd have to do the math, 15 years.
Yeah.
No issues, no anxiety attacks, like if nothing. And then one day woke up and started feeling brain fog, and I was getting ready to go to work for the day, and the room started moving, like rocking back and forth. I called it dizzy, but people think dizzy spinning, but it was just rocking. And I was like, well, that's weird. Forgot about it. And then for the next like week or so, it would happen a couple times a day. I'm like, this is weird. It started not to be able to think again. And then one night, woke up, room was really rocking. I got extremely sick. I mean, like my heart was going crazy. I was I'll just leave it at that. I got very sick.
Yeah.
And left
Keep it PG.
keep it clean. But the left side of my body went completely numb. And so my wife is I'm waking her up and stuff. It was the middle of the night, and trying to express what's going on, and she's like, we gotta like get you to the hospital, like I think you're having a stroke. And I'm like, I'm stroke, I'm 38 or 37 at the time. I'm like, there's no, I'm okay, and she's like,
But
no.
I'll go.
Yeah, and I'm like, I'm like, oh, well, I'm not okay, but let's go. So anyways, all that, it wasn't
The same story again, right? Hey, everything's okay, right?
Yep.
Everything was cleared, but you're still having all these symptoms.
So no stroke or anything like that, but felt like it and had all these symptoms. And then I think about 2 months later came to you.
Okay.
And our first encounter was hilarious. I'm sure I was hilarious.
Oh, yeah.
Because I was trying to tell you how
So
to
you
do
were there
your-
with Jill, and you're like, you like warned me, like, just so you know, like I'm very skeptical coming in here,
Yeah.
but and so we did the pulse ox thing on your finger,
Oh, yeah.
and we did the breathing to show you that you can make a physiological change in your heart just by breathing a certain way, right?
Yeah, absolutely.
And you were like, all right, I'm in.
Yeah.
That's basically like how it went, right?
Yeah.
There was more to the conversation, but I know the thing at the time I think was that dizziness that was really messing with you. Definitely it was positional. I remember, it was around Christmas time, and you looked up, you're hanging stuff, and the next day you were like, whoa, you're out of it.
Yeah.
And so, if I can kind of lay the foundation here, he'd been still seeing, I can't remember her name, but the counseling.
Oh yeah, it was with Stories.
Yes,
Counseling.
yeah, Stories Counseling.
Yeah.
And so you've been working through all of those things from like childhood stuff and just whatever was present. And so so you're working through that. You had seen PTs, chiros, just kind of all the way through. You're just always working on yourself, trying to figure out why you're not like in tip-top shape.
A lot of ear doctors, everyone's telling me it's just an inner ear problem.
Yeah.
So
And so and so like, you would get some help, but then nothing would really take care of most of it, right? And
I don't think I had, honestly, like I don't think I had any relief. Like I would try different things, and like, did that make you feel better? It's like, no.
Yeah, and that's the tough part with a patient like you that thinks like you is you've got to have like the proof.
Mm-hmm.
The proof in the pudding, right? It's like, hey, I need you to trust me. You're like, okay, like this is what I do for a living. I can't just trust that X, Y, Z,
Yep.
And so it was a challenging case for me because I knew that I had to show you the physiological changes and the diagnostic changes or the heart rate changes or the symptomatic changes like very quickly to make sure you were on board.
Yeah.
And I mean, granted, I do that every time, but it was even more important in your case because you would have probably gone away if you didn't have the result in a short amount of time.
I mean, my favorite part of our first appointment, I guess, was when you strapped the goggles on me and started measuring. Because as an engineer by trade, You know, it's just like, don't just start guessing. I felt like doctors were just guessing what to do. Oh, maybe it's this, maybe it's that. So you took some and created some data, created some hard evidence, and then you kind of helped explain to me exactly, at least from a neurology perspective, you explained to me what was going on. This is weak, this is strong, you're good here, but these areas are weak, so we're just going to work on strengthening these areas. And so that was honestly what kind of, you know, like that was my 2 thumbs up. I was like, I can deal with this guy because he's actually
on board with this.
Yeah, he's measuring.
Super cool.
So, yeah.
And so what was the experience like the process like? How was that the same or different from other things, and how did it fit into what you needed?
How was it different? Well, let me explain the process. I guess that I went through, assuming it's similar to how things happen now. You know, but there was the, you know, the assessment, and then the exercises, which I really liked as well, because once again it's like a process. So it's like just follow these and do these every day. I am glad you put that pulsometer on me to show that like breathing actually had an effect. I think I went and got
Oh, you probably had one ordered for you out of the
no,
office.
so I took it a step further, and if you've heard of heart math, which is the HRV type of stuff, so I started researching HRV and all that stuff. But anyways, so going through the process was just really helpful, and I will say I noticed a difference immediately, which I had little glimpses of hope, like immediately, which I hadn't experienced in, I think I was, after all this happened, it was, like I said, a few months. And I was like, oh wow, I can, when I start feeling it bubble up, I can do something as simple as breathing. And like, it would go away, you know? Not all the time, sometimes they're a little bit heavier, and I had to build up the tolerance and build up the strength. But yeah, totally different than anything I've experienced, because it worked right away. There's not many things you can mix outside of a pill, maybe. You can pop a pill and wait 20, 30 minutes and feel the effect, but breathing's even quicker.
It's free and it's immediate. You know, the thing with, and we see a lot of different patients that come in at different places, right? Some can be like rock bottom. The rock bottom ones are going to have to breathe a lot more, right? Those kind of in the middle, where I'd say you were kind of like, you were not feeling good, but you weren't like lost.
Yeah,
right?
I could still work.
You were still working, doing all that.
Things.
So you're probably 50 to 70% is my guess. And so we were able to get a little faster result because of that, right? So if anybody's listening right now, we use a 5-15 breathing pattern, which we used to use 4-4-8. But now we've kind of abandoned that and moved to this 3 breath per minute pattern. And I mean, I'd say we hear more people say now, that it's like changed their life than I ever had before in the Chandler office. And so, so that's what we're doing now, and it's specific, like the recommendations are specific to each individual, like, hey, start here, move to here, move to here, move to here. You might have to be up at this level in order to feel a difference, because you've got all these things going on in your life surrounding you, in your face all the time. So like, you're literally in the middle of a battle. You're not gonna feel better right now. But we're gonna set the stage and create the habits for you when those things come down a little bit, that all of a sudden you've got your foot in the door to get better. Right?
And I'll say this too, if I may, like on it is, I still do it today. I think you started me out at like 150 breaths a day, which was that 30? Is that 30 minutes or something like that? I'd have to do the math.
It's like 3 minutes.
Yeah, so I would do like 3 10-minute sessions. Now I just do when I have time. But there's something about it works until like it works as long as you're doing it, which sounds so simple. But it was working, and then I was feeling better. So then you forget to do it.
Totally.
And so now, you know, at the time I had to create a habit, like just put it in my phone, remind myself, like, hey, just take 20 breaths right now. And now I just do it without having to be reminded. But it's really interesting. Like, you just got to keep doing it.
It's totally, like, a lot of what we're doing is, gosh, like the reset part of it is almost like we're resetting just habits, right? It's more complex than that, and it's different than resetting habits. But all right, we listen to how people think and the words that they use, and like fear responses and just all these pieces of the puzzle like add up to be your case. And so I know yours specifically, like I'll never forget this because I thought of the analogy right then and there. Excuse me. But working at home over COVID became a normal thing.
Yeah.
And so I remember you had made the comment, I have a hard time turning off work when I leave my office and go into the kitchen or to interact with my family.
Yep.
Right. And so I was like, all right, well, let's do this. And we tried like a technique of, here, we're going to, do something with the handle. The handle is the trigger for your brain to realize, okay, I'm done working.
Yeah.
And then it's like we're able to start to separate and activate and inactivate certain brain structures by doing these things, right? Because work is usually highly stressful.
Yeah, I'm in a high stress job.
And so tell us what you do. So because the stuff that we've been working on or we've worked on in the past has to do with a persona, or like there are so many people like me out there. So what's life like?
So I've engineering, software engineering, my whole life, but for the last 15 years it's been in architecture. So officially like a solution or principal architect, solution architect. And so people come to me with their problems, and I design a solution, architect a solution for them of solving their business problems using technology, basically. Normally that comes into creating some custom software. I don't do the writing anymore. I'm the architect, just like an architect of a building. I'm not the plumber, I don't do the drywall, I don't do the electricity, but I make sure that all of those pieces come together and work together. And so because of that, it's a high demand stress type of a role. I work for a consulting company, and so it's honestly 10-12 hour days that I'm in my home office now, sitting in front of a computer. Luckily I have a stand-up desk, so I go up and down, but I mean, if you looked over my shoulder of my life, for 10 to 12 hours a day, you would see me sitting at a computer typing away, talking with people at meetings. It's and high stress type of environments, I would say.
Yeah. And so we've talked about that persona, like you, like being in your 30s, 40s, 50s, having this high intense job, maybe whether it's like the stress, like there's a lot coming at you, or you're like, hey, these are 10-12 hour days. It's intense. Like it's not stressful, but it's intense. Either one is kind of the same difference to the human body because they releases the same chemicals. Yeah. Right.
I have fun doing it. That's why I do it. Yeah. But it's like, working out, and if someone's lifting a whole bunch of weight and it feels good for them, but it's still putting stress on their body.
For sure. Yeah. And so as we went through your journey, we were kind of aligning these things and bringing the understanding of what is the impact to your human physiology, whether it's your neurology, your gut, your skin, your sleep schedule, whatever it is, with this type of thing happening 10 to 12 hours a day, right? Yeah. And then, so then we talk about that stuff, and then we start to see a little bit of improvement, right? And then, well, the question's kind of like, well, why am I getting better now? Like, what's the difference? And then people start to mention, you as well, but generally, people have that ability or create the ability to like do a little bit more. Where if they used to, let's say, go for a walk with their wife, like they couldn't go very far because they'd start getting maybe symptomatic, right? And that's where we started talking about, your word was the ceiling, and my word was tolerance, right? And it's the same word, same thing, two different words, right? When people go through stuff, whether it's stress, just chronic daily stress that's nothing outside of the norm, just work or family matters or childhood stuff, or your chemical intake of food has just been so bad, it all creates that stress response in the human body. And then after a while, that stress response starts to become a little more dominant and a little more dominant. And then it becomes like a habit. And once we reach that point of habit and you are in that fight or flight response, you're not in a healing position. Yeah. And so it's like we've got to do certain things at certain times to get you to breathe and calm yourself down, so then we can go and work out if that's the thing, right? Yeah. Sorry guys, I lost my voice the last couple days, so I'm trying to keep it cool here. But then like, had you come in and I said, hey, you know what, it's your neck, let me just adjust you, right? And it feels good because we have the pain on the right side of the neck thing.
Yeah.
And that, if that got too bad, it would cause your symptoms, right? So I had to figure out which one I needed to do first, or kind of do I do them parallel, right? So I think we figured out that like the adjusting for you, for your like neck and shoulder and upper back, was kind of like a Band-Aid to keep you feeling good enough while we could work on the neurology, right?
100%, yeah. But it was a good Band-Aid.
Yeah.
It was a good like ace bandage
Yeah,
type of thing where it's like I needed it and it would get me through a couple days.
Yeah,
you know?
exactly.
And that time just kept, as we worked through the neurology, the time just kept expanding, expanding.
And we were just talking today, like, I know what my technique does. I use chiropractic as a tool to get the body just moving, right? I'm not usually using it as alignment, right? So in that sense, you could call me like not a typical chiropractor. There's other chiropractors that focus only on alignment, right? And when you talk about alignment, the question you asked was, why does it keep coming out?
Yep.
And so for me, to me, it makes sense to reestablish proper function of the neurological system and that fight or flight system first before you go in and do all the structural work, right? And that's what we do with most people is we work through the neurology and then we start getting into physical activity, and usually then we start doing more physical work like adjusting muscle work, stuff like that.
Sure.
And then by the end of it, it's like, hey, we'll just do like some maintenance stuff. And at some point it becomes like as needed.
Yeah.
Right. And so Ryan, what we just talked about was, we've worked together for, gosh, I don't even know how long it took, 6 months?
Oh yeah, for us. I
Yeah,
thought you meant like how long ago it was.
No. It was probably 3-4 years ago.
It was 3-4 years ago. Yeah, I would say about 6 months.
Yes. So we spent about 6 months working together to like reset that system. And I'm using your language that we kind of, the keywords, right? Like reset the neurology, hence like the NeuroRESET program. And that's kind of where it was born for all you guys listening. It was actually Ryan and I talking about all these things, and that's really where this NeuroRESET program came from.
Yeah, I had to put a process to it. So
Yeah,
I had
exactly.
had to come up with names of the process.
Exactly. And so as we're working through it, we got through the neurology stuff. Then we started getting into some minor exercises. Like I think we did like a no-no while you were doing a core work. And you're like, this makes so much sense.
Yeah.
Because when you fire them together, you wire them together, right?
Yeah.
So like if you just did one thing, like if you just lay down and did a bench press, like yeah, you'll get stronger in that movement. But if you create like different positions of like a push-up that's more functional, you're going to have an overall strength improvement and injury reduction or risk reduction happen because you're training everything.
Yeah, I never concentrated so much working out. I didn't realize
Yeah,
you could concentrate. Like it's difficult.
It's
to
difficult. So
get those two going.
And so like as an example, if you guys are listening, if you have a chance, like whether you're at the office or at home, what I would do is try to stand on one leg for like as long as you can, say like 15 to 30 seconds, and just keep your head still. Eyes look like on a target, okay? You can do one side, like the right leg, and then the left leg, and just kind of compare them. See if you can hold for 30 seconds. Then the next thing you're going to do is you're going to find 2 points, like with your vision, and you're not going to move your head, but you're going to move your eyes back and forth while still trying to stand on one of those legs. And then you're going to start moving your head after that, and you're going to try to do each one for 30 seconds. And then what you want to understand is if any of those are breaking down, there's breakdown in the whole system and the integration of the system. Like if the eyes are what throw you off, you've got an eye tracking problem. If your head is off, you've got like a head, neck, cervical, ocular reflex thing going on along with your proprioception. They're not telling the same signal.
Yeah.
So when you're architecting the neurological system, I've got to look at the eyes, the vestibular system, and the orthopedic system, or the proprioceptive system. We have to work all of those through the program so that we do the neuro, we do the breathing, we do the chiropractic work, we do the physical exercise, and then it's like, because we can't do psychological work, we can give you tips and tricks on what to do and what not to do, but like that deeper stuff that deals with like trauma and things like that, that's when we can make the referral.
Yeah.
Do you, out of curiosity, do you remember, because you were seeing stories counseling all the way through our program, do you remember what happened? Like, well, let me ask you this. Like, I'm not going to tell you. were you having big breakthroughs before we worked together or after, or like during and after?
Yes, I mean, I'm a big believer in counseling, so I've done it for years and years. So I was probably working with the folks at Stories, oh man, I bet 5 years before. I would have, I don't know about breakthroughs, I'd have awareness breakthroughs, which I actually like the aha moments. Like, oh,
yeah,
that's why I believe that, or that's why I do that. But I honestly wasn't able to get past the traumas. Like, it's like, oh yeah, it's there. And then anxiety would kind of come up and would have to go actually to techniques to kind of consolidate them so that they, to say, hey, I'll come back to you one day. That one day was actually after I went through, the RESET program.
Yeah.
It wasn't the RESET program at the time.
It was being born.
Yeah,
right?
we were naming it, but going through that, I was able to then, go in and say, have the strength, I would say, to go in there and be like, hey, I'm ready to kind of, let's open up this box. Like, really, just let it peek, know?
Yeah.
I'll be honest, like it can be a little bit scary, but yeah. And then I was actually some of the fears that I've lived with forever, and you kind of, I don't know, I just bottle them up. Like, they only would come up when
everybody does, right? That's what we all do.
You don't think about them. It's just, that's the whole point. You learn how not to think about them until they come right in your face. I was able to bring those out in the open and have conversations and completely work through them, and now can share stories about, I can never even talk about my, I'd say trauma. I'll say little t trauma, like they say big T, little t. Like, I'm not talking anything super, super crazy. But for my mind and body, it was it was trauma. So going through those things, it was, I can talk about them openly now and work through them. So that was a big change. I was always afraid when I learned through this other chiropractor when I was, 16, that these, what felt like seizures and presented as seizures were caused by anxiety and trauma. As an engineer, I put that together and to say, well, great, I'm going to make sure I don't let any of these come up because I never want to experience this.
Sure.
It was
just not going to open that program.
Yeah,
right?
like, I'm never going to do that again. I always called it the alley. Like, that alley, every time I go down that alley, I get beat up. I'm never going down that alley again. And now I go down the alley and realize that it's actually not so scary.
Love it. And so people that are listening, they're all dealing with these things. They just might not be able to explain them. And that's one of the things that we try to do here is help you understand like what and why you're doing the things, or you experience the things, or you can't do the things that you want to be able to do. And so because our conversations were so much like this all the time, just constant, like going deeper than because you could. It's how you think about things, right? And so what do you think, let me see here, how would you explain what we did changed in you to allow you to tolerate going to that level and finally being able to ultimately process and handle that? Because I'm going to throw out, like, your words were ceiling, right? And then you'd also mentioned you had the strength to do it.
I like the ceiling analogy, or I'll use a different analogy though that came to me. It's like a battery.
Okay.
And I feel like life there's things in life that depletes a couple percent, and then there's things that fill it up, right? So if you're depleting it down to, let's say, 20%, you're feeling pretty crappy at 20%. For me, that would be the end of, potentially the end of a work day. Not because of work, like I said, love the work and everything, but it's depleting.
It's just draining.
It just takes energy. And then so what you had described to me was, let's go through this and strengthen your brain, because there's two things we can do here. And we can either remove some of the things that are draining, so your battery's not draining so quickly.
Which we kind of talk about as avoidance behavior, which we don't always want to do. Some things we can, if it's toxic, avoid it. Sure.
Sure. Some things you can't not do.
Right. Exactly. Like you can't not go to work.
I have to work.
Yeah. Exactly.
Yeah. Or I have to, take care of the house or take care of the yard or whatever it is. Like there's things you just have to do. So that being said, though, there was a lot of things that we worked on eliminating that were draining and were never fulfilling. And it was like, well, why are you doing these certain things, right? And then the other thing that was a big eye opener for me that I never realized before was to say, or we can build you a bigger battery.
Yeah.
Like, oh, wait. I like that idea.
Yeah.
So then I can go through the same amount of stress. I'm putting this in quotes, just, not bad stress, just stress, use of energy. I can go through the same amount, but instead of at the end of the day being at 20%, I'm at 50% because I just I got the Pro Max
capacity.
battery.
Exactly.
I got the big one,
Yeah.
and so.
The more capacity, right?
Yeah,
And,
100%.
and so the words and phrases that we'll use is, I like the word tolerance. Like I can tolerate work better.
Yeah. Like raise your tolerance.
Yeah, raise the tolerance. In the beginning, he was using the word ceiling, and he's like, my ceiling was like, and you would put it like right at your top of your shoulders.
Yeah.
So anything above that was really required energy would just gas you out.
Yeah.
And something as simple as hanging the Christmas trees could set you off at that time.
Yeah.
Then there were other times where you're like, hey, I actually took them down and I was fine. And so like and the way these symptoms respond isn't like they just go away overnight, right? So you've got to look at the severity, intensity, duration of all that stuff. So like if the dizziness that you were experiencing just comes down by like 20%, 30%, cool, like the intensity. Instead, it might not show up every time you do the same thing, right? So those are improvements. So we've got to be able to find those little wins and focus on those wins. And then we have to go back and look at what did we do to create that win, right? Because then we go back into the process, which is, I think, where you lived.
Yeah.
And so, what we're trying to accomplish here is there's a process that happens that then creates a result. Once you get some of that result, we go back and help you focus on, hey, this process created that result, so let's do more of that process.
Yeah.
And then you get more of the result, right? It's like, if you go to the gym, you're going to get stronger. If you go one time a week, you're not going to get very far. If you go twice a week, you're going to get a little farther. 3 times a week, a little farther. 4 times a week, that sounds awesome. 5 times a week, okay, we might be kind of going the other way, getting into the red zone where we're going too much. And then 6 days a week, certainly you're burning the candle. 7 days a week, you're toast.
Yeah.
Right? So it's like there's a happy medium, almost like a bell curve of things that you can do in this process. The higher you go on that bell curve, the more you're making that battery bigger.
Yeah.
Right? If you go too far, you start making that battery smaller again, which is really interesting because that's basically what you're describing is 10 to 12 hours a day, right? Where, midway through the day, you might be fine. It's that additional 4 to 6 hours that end up just cooking you and exponentially drain that battery, right?
Yeah, absolutely.
And so I just kind of had to say it from my point of view so that anybody that ends up calling us or comes in and we have a conversation, like this is what it's going to sound like, but it's going to be very specific to the individual.
Yeah. And can I say one thing on this too?
Absolutely.
Because I think this is interesting because I think a lot of people, at least I have a lot of buddies that I work with that express this to me. And so with the ceiling analogy, it's like my head's always hitting the ceiling. So then what would happen is you could coast through most days and it's right above you, but you don't really know. You don't hit it and you're like, I'm fine. But then when something of significance happens, you're like, bam, you whack that thing hard. Mm-hmm. And you have a weird event. And my buddies have described, they're like, oh man, I got this weird pain, or I started feeling strange, or just like, it's like the random things that you go to, sometimes you go to a doctor for, and they're just like, you're fine. Everything looks fine. There's a lot in those confusing things that happen to you that they can't run tests and tell you what it is.
Right.
Those are triggers.
You saying that actually clears up a lot of what I was trying to explain a lot of times. So, how many times I can tell you, almost everybody that comes in here has an event, just like you described, like my whole body went numb, or the whole left side of my body went numb. went to the ER, completely fine.
Everything's fine. Your numbers are good. Blood looks good.
So when you start seeing stuff like that, you leave the pathological world of what a lot of people can do for you because they live in the world of pathology. I have crippling anxiety. Here's a pill, right? You get it under control and you band-aid it so that you can then go fix the problem. Well, what's the problem? That's where we come in with our data stuff, right? So we do our measuring and say, hey, these parts of the brain aren't working as well, or they're not integrating well with the other parts, right? And the history tells me almost everything I need to know. Based on your work schedule, it's like, okay, so you burn the candle at both ends almost every day, 5 days of the week. Is 2 days a week of recovery enough? Doesn't sound like it, right? And then when you talk about that ceiling, excuse me, guys, when you talk about the ceiling or your tolerance, right? It's being right above your head. Well, a stressful day or whatever event, and you smash into that or bust through it, and all hell breaks loose.
Yep.
So how are we going to fix that when you're in this world?
Yeah.
Right? If you're in it all the time, it's going to be little tricks of the trade of like, hey, if the first thing you say when you wake up is, God, I do not want to go to work today. Guess what? You just took energy out of that battery just by saying that.
Yeah. Just
right?
the thinking process.
Just the thinking part of it,
yeah.
right? And so,
I think the biggest thing, sorry to interrupt you, but
Yeah.
the biggest thing for me from at least the way that my mind works, that was never told to me before, is that you can, because it's scary. It's scary to think. I've had 1,000 people tell me, well, maybe you need to do something different. And like, you don't understand. I like what I do, and this is what I'm good at. This is what I'm trained to do. I can't just go pick up another job because I think I'm going to run into the same issues, by the way. And it's not that the job is stressful, it's just taking time. The thing that, honestly, I've never thought of that's the simplest thing is where we talk about increasing capacity, or for the ceiling analogy, I think you and I use the term margin, or I heard it from someone.
Mm-hmm.
It's like you should always have a level of margin in your business,
like margin for
in
error.
your body.
Yeah.
Yes, you always need a little bit. So if you run at 99% capacity, you by definition are not over capacity. You're fine, except when you need an extra 10%. So if you don't have that 10%, 20% of margin, when those events come and hit you, you have to bust through your ceiling,
Right.
which in my case creates some pretty wild physiological responses.
Yeah, like stroke-like, seizure-like.
Yes.
Right?
Yeah.
And so by the way, that whole seizure thing that you were dealing with as a kid, now the diagnosis for that, as long as the EEG is negative, is going to be like functional neurological disorder.
Okay, wow. They called it, for me, they called it pseudo seizures.
Pseudo seizures.
Pseudo meaning
Yeah.
fake.
Uh-huh.
And I hated that.
Yeah.
I was like,
Well,
what?
you
No.
do, yeah.
Oh yeah, I'm like, fake. I thought they, because I was young when I first got diagnosed with it, or told about it. And I was like, I'm not faking this. I remember having a conversation with my mom and being like, I promise I'm not faking
Yeah.
this. She's like, no, that's not what it means.
Yeah.
So
And it's, and thank goodness, like there's diagnoses coming out for stuff like that. Because I mean, everybody that comes in with anxiety, the last thing they want to hear is it's because of your anxiety, right? And so,
yeah, just
like,
don't worry so much.
yeah, worry less. You're like, oh, okay, that's simple.
That fixes it.
But when when we do joke here, like, oh, well, yeah, it is in your head because that's where your brain is, right?
100%.
It's in the vault, right? So we've got to figure out why that brain function, as it is now, is producing that symptom.
Yeah.
Right? So when you look at things like anxiety, you're looking at an area of the brain called the amygdala, which is the fear center, and then the opposite, or you can kind of think of it as like an angel and a devil on your shoulder, right? White and red, right? So red being bad, the amygdala, that's the fear center, and then the frontal lobe being the white part, which is your angel, right? And so in situations of higher stress, you start to activate that amygdala, or it grows larger, right? By default, the frontal lobe starts to decrease.
Like physically?
Physically decreases in the
activity.
functional activity.
Okay,
We'll say like
yeah.
batteries, right?
Yeah.
So your battery goes up in your fear center or the amygdala, and the battery goes down in your frontal lobe.
Okay.
But you need that big battery in the frontal lobe to control and dampen the amygdala.
Yeah.
So by default, when people have high stress, it literally causes change in blood flow to the front part of the brain.
Mm-hmm.
So if you have less blood flow to the front part of the brain, that, by the way, inhibits things like anxiety, depression, ADD, ADHD, OCD, insomnia, overthinking, stuff like that, addiction, all that stuff. That a lot of that comes from that front part of the brain. Not in every case, but you can use that as a generality. How many people do you know that have the things that I just listed?
Yeah, tons.
Yeah, like most people.
Yeah.
I mean, even myself, if I get tired, I get a little, like lack of focus.
Yeah.
And so when people are having to focus all day for 10 to 12 hours in a stressful situation, like that is extra burning that battery, or like you're extra pulling out of that battery. So if you do that for 10 years, what do you think the outcome is? Well, what happens to our cell phones after years of use? We stop being able to charge it all the way back up.
Yeah, that's a great point. Yeah.
And so
100% is now like 80.
Yeah, exactly. And it goes faster.
Yeah.
It's dead by the end of the day, right?
Yeah.
And so
and that's the opposite of the margin that I'm talking about.
exactly.
Yeah.
So then we've got to do something different, right? And that's where we introduce the breathing. The breathing is what allows us to just add a few percent, right? The more breathing we do, the more percent we can add. But then it still drains the same. The strengthening aspect of the rehabilitation or the exercises that we do are what keep that percentage as high as it can, as long as it can.
Yeah.
So it takes longer to drain you, or more crap, more baloney, more stress to actually drain your system.
Yeah.
Right? And then if you are actually stronger, right, over time, and we were talking about a friend of yours, when people do have those drops, those major drops because of these big events, they are able to charge it back up that much faster and like recover. So as an example, we had a migraine patient in just today. She would usually have a 2 to 3 a month, but she would have 2 days. Once she has an aura, she loses vision in one eye, and then she gets a migraine, tons of pain, and then she's in bed. She sleeps it off and then has to stay in bed for 2 full days.
That's interesting. So, sorry, you just said some like trigger. So, like for migraines, you have auras.
This particular person can,
Oh, no.
yeah. So there's migraines with and without auras. There's all sorts of different migraines, but in this particular patient, they had the aura, so they knew it was coming. So even if there wasn't any pain, vision starts to get weird in one eye, they know a migraine is coming.
Wild. Okay.
So we've gone through the process. I think it's been about 2 or 3 months now. So we've gone through the resetting, which is a lot of the breathing, and then the strengthening piece. So now, and she knows exactly what is going to be her trigger. And so we're now working on all those things, because she goes on vacation the first or second day, every single time she, without a doubt, gets a migraine. Now she starts to lose a little vision, gets a little bit of a headache, goes and lays down, wakes up an hour later, back to having fun.
Yeah.
No meds, no nothing. And so we're able to reduce that significantly. I know that if we continue and we keep diving deeper, that ceiling of hers is going to go higher and higher.
Yeah, totally.
So she's going to have that margin or the safety net left over, so that when the big stress situations are like, international travel comes for her, that she's not going to fall apart. And that's where, one day I remember us talking and you go, I know my ceiling is going up.
Yeah.
Because
100%.
my word is tolerance, yours was ceiling. And I was like, that is fantastic. So
Yeah.
so it's those little wins. It's like, all right, so what did we do to make that ceiling go up? Right? That's the question.
Yeah.
So then we bring back that focus to, here's the process. If you stick to the process, and you have to trust in the beginning, but then when you have the physical data to show, you're like, okay, this is working, great, keep doing that.
Yeah.
And then it's my job to keep pushing you like a personal trainer, just making your brain stronger and stronger.
Yeah, and I think remembering to just keep doing what worked, but like you said, like in the gym, you eventually you kind of like, I felt like my capacity, tolerance, margin was really high, and still is. But then it was like, hey, I come back to you every few months, right, and be like, hey, how do we like how do we up this even
Yeah,
more?
and so-
I've maxed out the bench.
Yeah, so
you
we've
know?
maxed out what we can do, right?
Yeah.
And then that's why I refer to other specialists and other people around town.
Yeah.
And usually it's a psychology-based referral. But that was being taken care of parallel.
Sure.
Right? And then it became more of a physical thing, like the orthopedic piece. So my adjusting could help, but it wasn't fixing the problem. And then I think you tried it before, I can't remember, but you ended up engaging in upper cervical care.
Yeah.
Right? So, and I mean, we just talked about this, like you're seeing a local doc that we share a lot of patients, and he's an awesome doc, but it wasn't until, like in your comment, I'll let you explain it, but it wasn't until you did the reset that had the platform to just completely thrive off of, right?
Yeah. Yeah. I mean, for one, I wouldn't have even walked into his office and think that it would have any impact whatsoever
Because nothing worked, right?
Because nothing worked. And so my belief system at the time was that absolutely nothing will work. And whatever you believe in normally comes true.
Yep. If you think you're right or if you think you're wrong,
Yes,
or
exactly.
think you can or think you can't, you're probably right.
You're probably right.
Yeah.
So I think that was the big change. It opened up my mind. And then when I would have I can pinpoint it almost down to the day of what happened. And that was I'd been working with you, and then I was pretty much at home care, if that's a thing.
Yeah.
You know what I mean? I was just doing
maintaining.
the maintaining programming, felt great. And something happened, and I had an episode very light compared to what I used to have. But I was like, oh wow, I'm feeling this and stuff like that. But I wasn't anxious about it. It felt 100% physical, and I'm like, there's something physically going on right now. So I was able to breathe through it and kind of check in, scan my body, and be like, what? And I'm like, oh, it's coming out of my neck here. It's coming right from my neck. Even though it's weird to describe, even though the symptom was exactly the same. Like if you just looked at the symptom, if I could draw a
From
picture
like before we met to after
from
we met,
before to what this was at the time. The dizziness, the brain fog, it's like the sensations were exactly the same. But my mind felt completely different after working with you.
like the nervous system piece, that amygdala was like, hey, this is not what it used to be.
Yeah.
It feels like it, but it's not.
Yeah, I think I've seen like my kids the first time they got cut and they saw blood coming out, completely freak out. Now it happens and they're not happy about it, but it's like they can
Just wrap it up.
It's like, oh
Put
yeah,
some dirt
it is.
on
It is
go,
what it is.
Yeah.
So that's what I'm like. Oh, this is what it is. This is a physical thing, and so that is what led me down the path of like, maybe I'll go get this upper cervical thing, which we had talked about. And you said, hey, maybe it's an upper cervical thing, but I didn't have the ears to hear at the time.
Well, going back to, there's a time and a place for everything, right?
Yeah.
Like there's some cases that come in here that I might say, you know what, this sounds upper cervical, go over there now.
Yeah.
But generally, it's kind of one of those things that like most everybody benefits from, just resetting the neurology and calming down the fight or flight system, strengthening the brain, and then it sets a platform for anything else that you do to work better. From functional medicine to psychology work to physical exercise and tolerance on that end,
Absolutely.
to other chiros that do different stuff like functional movement type stuff versus, and the thing I keep coming back to is what you mentioned earlier, was why does it keep coming out?
Yeah. Why does it keep happening?
Yeah, like why does the neck thing?
Oh,
keep
why
going
does
out?
like, physically? Why
Yeah.
does it keep coming out?
Yeah. So so, the more stable your neuro is, the better everything else should work.
Yeah.
That's my personal opinion. Granted, I'm biased, but I have yet to have anybody prove me wrong.
Yeah. I think I proved you right. So
Yeah.
you're welcome.
That's N of one.
Yeah.
But yeah, I mean, and it's just, it's really, sorry, gang. It's really cool to see when people first come in and they're like basically a hot mess, right? And I know that that's not the normal for that person. And then as we work through, as we continue to work and the patient strengthens their system, like their real personality comes out. And it's like, in the beginning, we didn't talk about business all that much. Like we would touch on it, but it's always like, how do we get this in the hands of so many people, right?
Yeah.
And it became a dedicated journey because we didn't have to deal with the crap before, like that we were dealing with before,
Yeah,
right?
absolutely.
And so it's fun watching you become who you are now compared to who you were, right?
Yeah, I remember, like, there's so many times I've sent you text messages like, hey man, you never, like, and at the beginning it was things like, hey, I got to go swimming again today. I don't know if you remember stuff like that. Like, I can't go in a pool.
So first time I went in a pool because I didn't get dizzy.
And I was like, thank you, like, you're giving these things back. And then we went to Disney the one time. My family and I love going to Disneyland. And so we went there and there was rides, you know, and I was like, at the end of the day, I remember texting you and I'd be like, dude, like, you've given me this piece back that I can go and do these things. There was foods I could eat. Remember, I had like sensitivities to food, sensitivities to certain smells were driving me crazy. You know, like I couldn't walk down the like detergent aisle and stuff like that. So just those little like moments, you know, and obviously we've, you know, different relationship. But, you know, being able to text you and being like, hey, thank you, like something so simple as I can walk down the detergent aisle now.
And that's just awesome to hear. And it's that's what I get the most out of it is seeing when somebody comes in just not in a good place and like receiving those text messages or hearing like, hey, I'm going to Vegas next week for a friend's birthday. And before you're like, I don't even want to be around that stuff.
No.
Right? Like you never would have even considered it.
Yeah.
And now you're like, Disney, no big deal. All this stuff going back to Ohio, right? And like no big deal anymore. And that's
flying in planes. It took me a couple years to fly back in planes. So.
That's freaking awesome, man. Well, do you have anything that you feel like you need to say, unless we've already covered it?
I think a lot. I think I've covered most of it, but it is, you know, I guess I would end with like, trust the process. There is, if you're into engineering, and you're going to question, engineers question scientists, question everything. They need proof. What I enjoyed so much about working from you, like on the side, I call you Dr. Calm, right?
I thought it was Dr. Chill.
Yeah. Oh, Dr. Chill, Dr. Calm. Dr. Chill does sound.
It does. Sounds way better.
Okay, so let's go with
Dr. Chill.
So, you know, where the energy you put out, even when, you know, you know, people are coming in, or for myself, or you've even worked with some of my family members and things like that. It's just like this confidence, which just makes you feel chill. It makes you feel calm. Me as a patient, and so that's kind of the thing where, because when you're at the height of it, like I was, you don't want to go talk to another doctor because they almost make you feel bad. Some, not all. Some of them will kind of make you feel bad, or like, hey, this is all, you're making this up. This isn't a big deal. Stop worrying.
Or there's nothing wrong.
Fine. There's nothing wrong. All that, where you acknowledged the fact that there was something quote unquote wrong. It wasn't like something that wasn't irreversible. Of course it could, but it's like you put a name to it. This is what's going on. And by the way, we have a way to reset and fix this, and to make it better. It's like awesome. So that was very calming, and probably, you know, what I appreciated the most with the first time kind of working with you. So.
Yeah, awesome, man. Well, thank you. All right, gang. Well, if you guys have any questions on anything that Ryan and I were talking about, feel free to reach out. You can hit us up at a phone. You know, we can schedule a phone consult, 480-674-9199. Visit us on our website, check things out. There's a lot of, like, we've made a lot of videos, like 45-minute videos that like basically go through a whole consult at this point. So things like dysautonomia, overall, like just global stuff of what we do here. But I would suggest just reaching out and having a conversation. If you have felt like Ryan, if you know anybody like the stuff that Ryan's dealt with, we'd be happy to, you know, have that opportunity to help. Check us out on Instagram, Facebook, TikTok. I mean, our staff putting us on TikTok, like almost famous on TikTok. But anyway, if you guys have any more questions, just reach out directly and we'll take good care of you. We'll let you know if we think we can help or not. But that's it for this episode of the NeuroRESET podcast. Thank you, Ryan, and we'll see you guys next time.
Great, thank you.